Millions of women are living with pain, discomfort, and silence, told that it is just a part of life. It doesn't have to be. This is Healing at Your Core, where pelvic floor physical therapist Bree Allred brings more than 20 years of clinical expertise to the conversations women deserve to have. Real answers, real healing, no shame. And now, your host, Bree Allred.
Welcome to Healing at Your Core. I'm Dr. Bree Allred, and we're so excited to have our guest, Danielle Dickshinski, and she's an acupuncturist and Chinese medicine specialist, and also has some certifications in energy work and Reiki and trauma. And so we're really excited to delve into this. Today, we're going to be talking about endometriosis pain and how traditional Chinese medicine can help with endometriosis. So Danielle, go ahead and introduce yourself and just give them a little bit more of your background.
Hi, everyone. My name is Danielle Dickshinski. I am a licensed acupuncturist, Chinese herbal, or traditional Chinese medicine practitioner is the terminology. I own Thriving with Eastern Medicine Acupuncture and been practicing for over 10 years. I specialize in reproductive health optimization that include optimizing cycles, endometriosis, PCOS, fertility, male factor infertility, unexplained infertility, chronic pain, autoimmunity management as well. So I like to blend Eastern medicine, which is traditional Chinese medicine, acupuncture, Reiki I've been doing for 17 years. So that helps with regulating the nervous system and calming inflammation pathways. And I like to empower women with improving their quality of life so they don't have to suffer for so long.
I'm excited to get this discussion going. So first thing that we're going to talk about is, can acupuncture actually help endometriosis pain?
It can help. Go ahead.
Yeah, sorry, go ahead. That's really our biggest question, right? Is can acupuncture help with endometriosis pain? Or let's even just kind of give a bigger term of like chronic pelvic pain.
Yes. It can help with managing the endometriosis pain or the pelvic pain that leads on the downregulation that happens at the end. Because endometriosis starts with the lesions, then inflammation builds up over time, and the body's responding and guarding, then it'll lead to the chronic pain. And so it helps with different steps leading up to that point of the chronic pain that a woman's experiencing and when they're diagnosed with endometriosis as well.
That's great. Tell me a little bit, help us understand and our viewers understand how acupuncture can help address pain.
Yes, it can help with multi-layered approach, but the way it works is acupuncture helps, let's think. Acupuncture helps with regulating the immune system. So when you're putting acupuncture into the body gently, it helps regulate the immune system locally, but also works through the nervous system and helps rewire the nervous system's response to the pain. And that releases a whole cascade of physiology, immune regulation, pain relieving chemicals that has there. So as a local response and also a systemic response in managing the chronic pain and endometriosis there. And so it's simple too of acupuncture is different points. There's a whole world of it.
Yeah. Would you say that you're treating endometriosis itself, or are you changing the body's process of experiencing the pain that the endometriosis causes?
There's a duality there. For right now, based on the clinic and the response we're seeing there, and also study or research, it's helped changing the body's experience and processing of pain. Kind of how I explained, there's a local response with acupuncture, with the body responding to it right when you're putting it in, and also systemically of how the nervous system's perceiving and responding to the treatment. And herbal medicine, which is a whole other category we can get into later, is that there's some studies are showing that is influencing the inflammatory and immune system response that may affect the lesions, but we need more studies for that. So I will say more changing the body's experience and processing of pain right now.
Yeah. I think it can be helpful too, just to explain a little bit about how we're still learning so much about pain in the body. I think we both, right? It's like science is still trying to figure pain out, and it's so complex. And the more that we learn, the more we know we don't know. But it's really a neat thing that it's like there's two parts to pain. One is what's happening locally, where there's some receptors that are picking up that it's like, hey, there's something going on here. And then
Yeah.
the second part of that is the brain and how it's perceiving the signals that are being sent by the local tissues. So we've got these two parts. It's like, one, okay, what's being produced locally? And two, how's the brain perceiving that signal that's being sent, right? And so you're saying acupuncture can actually affect both ends of that relay system, to where it's like, okay, I'm sending a signal, I'm receiving a signal, and acupuncture is addressing both of those areas.
Yes, and, like, when we say in our medicine is we're addressing the symptomology the person's experiencing and their quality of life and the pain, and also the root cause, and so what is the root or the environment in which the endometriosis is in? So it hits from both ends all the time when we're doing treatment.
Yeah. Can you go in
Yeah.
a little bit more about how acupuncture is treating the nervous system? Like what
Yes.
changes, what happens there? How is it treating the nervous system?
So I'll give a brief of, like, people don't understand when you put a needle, a sterile, solid fill form needle, we call it, into the body. How's that even working? So first you have to understand that there are channels or meridians starting at the fingertips or toes, and they go from the surface of the skin and then they go deeper in. And once you go from the elbows and knees, they go deeper in and then they start connecting to the organ system, the cardiovascular system, lymphatic, nervous system. Everything is a whole highway and an internal network. So when I'm doing select points of acupuncture, each point has a treatment purpose and does have a physiological effect locally and also relating to the organ system that point is related to. And so when you do a combination of those points, you're having a treatment purpose and that in turn will affect locally in the full system. And so you are influencing the channels and meridians, which run between the skin and the muscles, which is in the fascia here. And there's a whole system of that I'm trying to introduce that so people understand it's not just bing, 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 we're putting it in and having influence. And so we kind of look at it almost like internal medicine when it comes with the acupuncture too. We're not just influencing the muscles or the fascia. We can talk about that too, but we're also relating to how the body's chemistry is responding to it.
Yeah. Tell me a little bit on how acupuncture can then affect a little more the local response, like the muscles, the tissue, the fascia that you were alluding to there.
Absolutely. Good transition. So best way, I'm very kinesthetic. So like when you see, say, is there a trigger point here, right? Say if I'm having, this is my leg, I have pelvic chronic pain in the pelvis. It can go down to the back, the hips. There's certain points and channels that come up from the ankles up the leg that can influence the whole entire pelvis. So you can either do points locally in those areas or also distal, which is away from that area. I do a combination of both. When you put the acupuncture in, you're not even going so deep. You're literally going millimeters if that's the case. And so you're working in the fascia, which we call the Sanjiao or the triple warmer. We've had that for 1,000 years as a definition. And was it Western science has discovered that a year or two ago called the interstitium. And so acupuncture has a huge interplay in that system there, which is right in that surface layer. So that is a whole network on the cellular level, on the inflammation, the immune response. When you go to the muscular level, you're influencing the motor plates, you're influencing the trigger points, muscles that are not, the fibers are knotted together, that are creating a pain response. So when there's inflammation, say the endometrial lesions grow, they have their own network of vasculature, and that can affect and torsion of the ovaries, the uterus, the pelvic bowl. That can radiate to the hip, the back, the lower hip, inner thighs. There's a lot of symptomology we will say I have with painful periods. And so you can release locally with the muscles attached to that, the fascia attached to that by trigger pointing. People use dry needling. We call it orthopedic acupuncture as a whole system of pain management in that way. And then also points that go more internally to those organ systems too.
Yeah. And where you kind of brought it up, I'm like, as a physical therapist here in the state of Utah, I can do some dry needling. I
Yes.
am literally just affecting that. I am not treating meridians. I am not treating the whole organ system with I'm like, there's very much a distinction between acupuncture and physical therapists that are dry needling as I'm looking at the musculature, trigger points, and
Yeah.
occasionally some of the fascia, but I am not targeting meridians, and all of that aspect of treatment there. Yes. And just a way that I explain it to a lot of people when we're talking about trigger points, I'll use my overalls here as an example, but it's like if I twist right here and pull on that, like you can see it's like pulling on my strap. There's some wrinkles that are coming down here. And it's like, oh, you can see that. Like it's pulling on different tissues when we've got something that's restricted in one area. And I think that's a very simple description that people can see, but it's like, oh, you put a needle in that, you release that, and it allows all of these other tissues that surround it to move better.
Yes. With
Go
your
ahead.
constriction and torsion, like you're saying, when you have constriction, there's not health there. There's not good flow of circulation. Everything is backlogging toxic wise there too. And that creates more of that pain response. So when you want softness and flow, that decreases the pain too in the tissues.
Yeah. Tell us a little bit about if we have a client that's experiencing kind of pain throughout the month, right? That might vary based on their menstrual cycle. Does that change what you're doing?
Yes, it does. So there is different approaches with acupuncture. You can do general pain, but if they are having pain, I've seen it with ovulation and probably a few days or a week before their period, depending on how exacerbated endometriosis is and their chronic pelvic pain. So usually, if they're first coming to me, we're seeing them once a week. And the point selection that you use is different each week because we're matching their hormonal cycle where, and pain response as well. And so we're trying to do it like after their period, after they're done bleeding, especially during ovulation, the luteal phase, which is like week 3, and then right before their period. And you want to do that weekly for a couple months. And you want to see the report of how ovulation is and how their period is, the experience has been for them. And usually it gets better. So we change the type of points, whether we're using local lower abdominal points, leg and thigh points, or lower back. But I'm always changing them foundationally each week.
Based on where they're at in that cycle.
Yes, based on where they're at their cycle. Yeah, but to finish that sentence.
Yeah, you're good. How quickly do you say that your patients will notice a change? So somebody comes to see you, and granted, I know this is a very generalized question because I'm like, when people ask me that question for PT, it's like, oh, well, it depends. Like, how chronic are these, and how long have you been dealing with them, and what have you done to address them, and how intense are they? But if you had to kind of give a general, what would you say is a typical timeline of response for someone? And if you have to say kind of, like this is a new issue, this is an acute issue. If you say this is kind of like a chronic issue, I can understand that things may vary.
I'll go from chronic to acute because when it's more chronic, because most women are not diagnosed with endometriosis 7 to 10 years in of suffering. And that's the hardest part. When it's that intense or that developed in that pain experience, I would say once a week for 3 months, because you want to give it at least 3 cycles worth to see how it improves. And I try to create general expectation based on like research and kind of like what I've experienced as a clinician. And it's about, I would say 60% better in the pelvic pain and the experience of dysmenorrhea probably by the 2nd month. And then we try to see how the third month is to optimize. If we need to maintain, we'll probably go ovulation right before their period, another couple months after that. And then when I've seen subacute, and I'm talking about teenagers, like we're seeing a lot of painful periods of preteens with the genetics of endometriosis or something run from the family. So I'm trying to get them diagnosed earlier on, and I see them coming in, and I've seen them respond the fastest. I've seen them where I'm treating them maybe twice a month. And right by ovulation for their period, and their periods are probably within 2 months worth of that. So that's 4 sessions. They're down to like 70% improvement. So it's just really interesting. If you catch it earlier on, they have a better pain rate, like lower pain.
Yeah. And there is a thing called centralization of pain, which means it's more nervous system based rather than what's happening in your system. And I think the more centralization we have, the longer it takes to reverse. So the more that it's like, oh, the brain, I explain it a little bit that our brain only has so much juice that it can extend in a day, right? So much energy. And it's trying to decrease the energy costs of what it's doing in a day. So it will push stuff into more of an automatic, like, oh, this has been sending this signal for 3 months. Okay, we're just going to put it on autopilot and we're going to sense that signal because I've noticed that it's not worth expending energy on to recognize it and deal with it, that it's like, oh, okay, it's just on autopilot. That's more centralization. And the more centralized things are, the longer that it takes to be able to improve it. Yeah. We have to get the brain to pull it out of autopilot so that we can change what it's sensing.
Yes, and that's correct. In the world of trauma-informed care, we use the word of window of tolerance. And so the nervous system is used to fight, flight, freeze, and fawning responses. which is always a sympathetic dominance or even parasympathetic shutdown. And
Yeah.
so then you have the rest, digest, and sex and things like that. They're more peaceful in this space. But your window of tolerance, when you have, like you said, the centralization of that pain response over time, your body almost encapsulates that pain experience to protect itself. It's a neuroprotective status. And so a lot of times when it's like kind of complex PTSD kind of thing too, especially with endometriosis. And so your window of tolerance is very narrow. And so you can't tolerate as much. You can't tolerate
Yeah.
certain pain, or you're used to a certain level of it. And so the goal is with treatment is to help the body gain trust, let the nervous system soften, and then it will stop compartmentalizing. Can never say that word. And it increases the window of tolerance, and so that you have a better response of, I can deal with this pain if it's painful during this period, or is less, or something stressful in my life, and come back to my center. Then I can rest, digest, and enjoy my quality of life and come back. And that's the capacity of health when it comes to that too. So that's just a different perspective I have of it as well.
Yeah, I love that. Would you say that your treatments tend to accumulate over time?
Of course.
Yeah.
It completely. It's if you're expecting acupuncture to cure or fix you in one time, you're not the right fit. I know that answers the question later down, but if you have this chronic thing that is genetic and it's been building up, even if it's a teenager having painful periods, it's going to take more than once. And we're literally, like we just talked about, we're retraining the whole system and help unwiring and unraveling all of this. So it takes time, and things do build up after another.
Yeah, I agree with that. So let's talk a little bit more about lifestyle and maybe kind of going into your herb side of things just a little bit as well, right?
Love it.
Tell us about how food, lifestyle habits, how that plays into endometriosis.
It helps significantly. Like think of endometriosis isn't now known. It's not just hormonal. It's more full inflammation type of condition. It's an inflammation and immune system type of condition. And so the immune system is centralized in the gut. Your gut is your second brain. Hopefully people know that by now. And that influences our nervous system and how our brain is less inflamed, and also how it can synthesize pain responses and also the lesions too. So lifestyle wise, the basics is whole food, eating locally, eating in season when it's safe, out of the sun or the lettuce. So you want to start with the basics there. You want to learn about the clean 15 and the dirty dozen. There's something you go on Google, you can print it out. They update it every couple of years, put it on your fridge. And if there's certain foods you like to buy more of those. For example, apples you want to buy organic, always, because they're heavily in pesticides. Anything that has a shell, like, bananas have the peels, avocados, things like that. Those are safe to eat conventionally grown. And so you want to learn the basics of food that way, is whole foods in season locally. Anti-inflammatory foods are going to be your best friend. So berries, high antioxidants. You don't have to go the whole superfoods thing. That's not true. It's more variety, color of the rainbow. And if you are drawn to certain ones, you can double up on what you like to eat. I like to keep nutrition simple because that is the hardest thing for someone to change, because it's micro habits that build up. So you want to kind of make it a game to play and then just work towards it. When it comes to like endometriosis and inflammation and in Chinese medicine, you want to eat things that are dark leafy green. You want to have more mushrooms because they're good for immune regulating, even if it's just like sauteing mushrooms. And that could be herbally too. There's a lot of mushrooms are getting more notice in the Western world for Western herbs, like lion's mane, cordyceps. You can Google them and they'll tell you kind of like what they're for, because they actually do influence the immune system directly or give you those phytonutrients that help. Let's see what else. Kidney beans, any beans, legumes are really good for helping with inflammation as well. But make sure you can digest them. So you have to make sure you're assimilating and you're able to digest things very well. Because a lot of times, if you have endometriosis, a lot of those patients have digestive or conditions that kind of match, like celiac. Yes. And so you want to make sure you soak them. You want to make sure they're cooked or stir fried. In Chinese medicine, we don't really believe in cold and raw things, which is really counterintuitive with smoothies and salads. In the Western world, I say it's a balance. If you're going to do a salad, then you have a cooked protein, like a fish or a chicken or something like that. If you're going to do a smoothie occasionally just to get something in because you're busy, then you're going to have a warm tea, a cup of bone broth. I'm not joking. Those work really well. It's easy. And some people whatever you're having as a warm beverage, kind of side by side with that. But you always want to eat as well to nourish your body. Like between 9 and 11, you want to have a protein-based breakfast because your stomach and small intestine is most active during that time. And there's lots of tidbits of information on that, but that is just like the basics.
So many people skip breakfast, and it's like, no,
don't skip
not
breakfast.
The best thing for you, right?
Your body will hold weight because it's starving. Even if you're swelling and you have more of like this edema type of response with endo, like you're just going to hold the water weight. And so you need density, we need nutrition. And a lot of women don't know that in our luteal phase, progesterone needs 20% more calories. Is why we have cravings, because we actually need more food for that hormone to be processed more.
Some of that intuition, right? We actually know it's like when you're hungry, this is why. It's like you're in a different phase that your body needs a little bit more.
Yes.
Yeah. And I'm like, we as women, and I mean, we could look at men too. They still cycle in a day, right? So they may have a time of day that they're a little bit more hungry or things there. But women, it's like our bodies are changing so much throughout the month, and we cannot eat the same every day, and we cannot eat the same every week and have it support our system in the way that we need it to.
Yes, it's really true. And a lot of people, the cyclic eating has been really huge on social media, like eat along with your cycle too. You can do that, but you don't have to be so strict about it and restrictive, because if you're already in pain, you don't need to live that way. But like the dark leafy greens, protein high up, especially ovulation on, your luteal phase needs it, and especially with these conditions we're talking about. And let me know your questions you have for herbal medicine, because there's a lot of information on that too.
So many.
Let me know.
So many. Well, let's even just go back a little bit to inflammatory conditions.
Okay.
We're talking specifically with endometriosis, but let's talk maybe a little more broad. If you have somebody come in, what are the signs or symptoms that you're looking at that would make somebody think like, oh, I've got inflammation in my body, and this might be a good treatment for me?
Well, everyone has inflammation in their body these days, but what really cascades into full on is first you're doing the medical intake. You're asking a lot of questions. In Chinese medicine, we ask the 10 questions. We're hitting all full body systems. So yes, most people are coming in for pain, but are they having brain fog? Are they having a hard time concentrating? Then I know that the blood-brain barrier might be a little bit irritated, or do they get rage from ovulation and then kind of like PMDD type of inflammatory response with a response to certain hormones, or they're not processing it right. So you look at in-depth cycle analysis too, symptomology, what they're saying, how are they feeling, how are they transitioning each week into that as well. Do they have any edema? Do they have any joint or muscle pain too? Because I know there's inflammation in the joint systems, because that can work. Are they nauseous during ovulation or before their period, or on up to day 2 of their period? Is a cardinal thing I've seen for inflammation too. They don't have a great appetite. They have low appetite, or they feel like it's a chore. So there's something shut down there, but yet they're holding weight and retention. So there's definitely different symptoms of inflammation I'm seeing there. Also, if they're mucousy a lot, then I know there's different types of inflammation in Chinese medicine. We call it damp B syndrome, and we call it damp heat, which is more like the excess, the redness, like more of that inflamed type of response that people
what
think
you would
of.
Typically think maybe when you're thinking something's inflamed, you get injured, you get that big, or you get a wasp sting and you get that response that's redness,
hives,
swelling.
So it's like that redness, the hives, the itching, the discomfort, the fever. That is like the heat kind of thing too. And then we have damp cold, which is more of like they get more swelling of their joints, they get more pain, they get more brain fog, lethargic, slower digestion, puffy tongue. When it's like cold and rainy and wet and cold, like wintertime outside. So it's actually like a deficient cold type of inflammatory response as well. And another cardinal thing you can ask is like, what's their body temperature like? What is their metabolic system? Are they running cold? Are they running hot? Are they pretty neutral in the controlled temperature space? Or do they have cold hands and feet? Or are they cold below and hot above? I've heard that a lot with my perimenopause patients too. So it's deciphering a lot of information and symptoms and sorting, and then you get the pattern, and then you can approach with treatment.
Yeah, that's great. Okay, now going into the herbs, like tell me, is that, and this is my lack of knowledge, and I think it could be helpful, but do all acupuncturists do herbology as well? Or is that an additional thing that you've become certified in?
No. So in education pathway with acupuncture, you are You get a master's in science. I have a master's in science and acupuncture. You get a baseline of a couple of traditional Chinese medicine classes. And then you will also can do an additional degree is another master's degree in traditional Chinese herbology. And so some will do it that pathway as well. So some will say I'm a licensed acupuncturist, but they say I don't do herbal medicine. There's a handful of states that require you to have that master's degree in traditional Chinese medicine to practice prescribe herbs. Other states, you could just be a licensed acupuncturist and then just have additional training. So like Western, that's like traditional Chinese herbology. Western herbology is more like certification programs that they have. And so like you have to ask the acupuncturist. Usually we used to call it NCCAOM as a national licensing board, and it'll list licensed acupuncturists and also say if they're like certified herbalists for that too. So you can kind of see where you are in your region and see how they're licensed and what their education is, because you have to meet certain standards to even be on that. And so when you're interviewing them, you can ask if they do both.
And I know there's a lot of hearsay of like, oh, these herbs are good for people in perimenopause or good for people with endometriosis. Do you recommend people start places on their own where it's like, oh, you may be dealing with some of these symptoms, maybe try some of these over-the-counter herbs? Or is it like, no, it's really beneficial to go and see someone like yourself that has additional training to get
It's a mix of
more
both.
guidance on that?
It's a great question. It's a mix of both. I am more supporting accessibility in medicine for people. And so honestly, like, especially in North America with Western herbalism, which we know about, if you have hot flashes, take black cohosh. Don't take black cohosh unless you need to. But like, there's like these signature, you have this symptom, take this herb. Herbal medicine is not that simple. But I also encourage people to play and see. Like, there's different tiers of safety with herbs. There's the culinary we use to cook a lot, turmeric, for example, things like that. And then we have moderate level of affecting, for like these conditions that you might want to work with someone like me that's certified and licensed, because the important things to consider is herbal medicine is medicine. And if you're using higher doses or more frequent, or you're going more of the potent type of herbs, you want to make sure it's not interacting with any medications. You want to make sure you're not allergic to it. You want to make sure it's not contraindicated. Like, for example, there's a lot of herbal classifications called adaptogens that helps you adapt to stress. But some of those herbal, like Western herbs, are not safe for those that have Hashimoto's, which is paired with endometriosis sometimes. I see a lot of formulas, even at natural grocers. There's a Hashimoto's formula or a thyroid optimizing formula, and it has those herbs in it that actually causes your thyroid storms or is counterindicated for that condition they're marketing for. So you have to be careful. If it's culinary based, go ahead and play with it. If your body's, there's a way I teach patients too, if they're trying different herbs or if I'm going to recommend and prescribe something, even if I'm giving it to them and you're sensitive to things a lot, whether it's food or allergies or you don't know, what you can do is take the herb, whether it's loose leaf or a capsule, and break it, put it on your skin for a moment and see if you have actual response. If you're like redness or itching or something, then you're not supposed to take it. If you don't have a response after a few minutes, then you can take a little bit, put it inside your cheek. And if you have tingling of the lips or any symptoms or something scratchy your throat, take it out immediately and you're not going to use it. And you don't leave it in for a lot.
Versus having it be ingested in your whole body and you're like, shoot, we just have to wait for it to run its course before it's done.
No, right? That's the cool thing with herbs is you can kind of see if it's kind of safer for you than like give it 2-3 weeks and we'll find out if it works for you. And if you don't have those responses, then take a lower dose, see how you do for a couple of days, keep that dose low. And if you're good for a week, then we'll go up to the medium level of dose that you can handle. And that's how I usually prescribe things, especially if people have a history of being sensitive to herbal medicine.
Yeah. And I think you really touched on it as far as like when you're prescribing herbs, it is definitely important that your medical providers also know if you're taking some herbal supplements or herbal prescriptions from somebody like yourself, because they can interact with things so differently and they can interact with medications. And it's like, yes, it's important because a lot of people are like, oh, I'm just taking some herbal supplements. It's like, no, your providers need to know when you're taking these as well.
They do. Even if they don't understand them, at least it's on your chart and it's documented. I always say, share what you're taking. Here's a list. I'll say, here's the ingredients list. Here's that too. The other side of that sometimes too, especially with Western like MDs, especially in the fertility world, if they hear you taking Chinese herbs, they'll say, stop that immediately. We know nothing about it. There's not enough studies to back it. And I always say, it's my job to screen in and out that whatever's interacting or what medication you're taking, say if you're doing IVF, like this is not safe to take, we're not going to do that. Or this one has been clinically sound, let's do that too. And so here's some information to share with your doctor to educate piece too. So a lot of doctors don't know herbal medicine. They're not experts in it, but it's okay to have a consistency in your chart and, knowledge and sharing that I am taking this for this. And then so that way they're cautious with what they prescribe as well, and vice versa for us.
Yeah. And I do think there's some things that we're getting better, right? With AI and with electronic systems, at least it might be picking up some interactions that maybe the physician's not aware of or your pharmacist is not aware of, but it may pick that up as well.
Yes.
Yeah. That's great. Okay. Let's move into fertility. Now, I know this is like a passion of yours and the excellent results with it. And I'm like, if you're looking for a girl, I'm like, Danielle is your lady. She does so many amazing things for fertility. So let's talk a little bit about cycles, because they feed into that a little bit, and fertility and kind of how acupuncture can help with fertility.
Acupuncture can help immensely. I would say traditional Chinese medicine can help immensely. And like acupuncture is one that we'll use consistently, and herbal medicine too, if it is appropriate for what the person is experiencing. But I mean, there's so much we can talk about fertility, but it can help with people naturally trying to conceive. It also can help complement or integrate is a good word I like to use if you're going to use REI, which is reproductive technology, like IVF and IUI, or if you need to do things like that. And so you kind of can plug in this medicine however you need to. And so, I mean, in the topic of like cycles, like I see women weekly, say if you've been trying for 3 to 6 months and it's not happening naturally. I like to do a functional med integrative approach. So I'm looking at what labs have you had done? Did you do any preconceptive screening? I think everybody should do preconceptive screening and prep for a year before you actually start trying to have a baby. And that is both your male partner and you. Because
okay, let's talk. I'm going to pause you there just because I know people would have this question. And I don't want you to give away like your secrets of your trade, but just generally, like, what are you focusing on in kind of those like preconception labs, or what would somebody be like, okay, my provider hasn't really recommended this. Like, what should I be looking at? And maybe some real basic things in that year before you start trying to get pregnant. What types of things do you recommend people do?
That's perfect. No, this is good to get out there because I rather you have this done before you come see me. It saves us a lot of time and energy, and it just helps. One, the male partner has to get a semen analysis ASAP. That is the only way to tell your sperm health. And so you might have to get it done once or twice. I like them to go see a reproductive urologist, and sometimes they might need a referral, so they might go to their GP then to that step, because I've seen them do a couple samples and average it out, and then you'll see better parameters too. And you want that analysis. You want it to not be just you never want to be in the low average, even if you're in range, because they have lowered down the standard since the 1970s. And so they have lowered the standard for male health. It actually should be in the medium level in those ranges for optimal health for sperm health. And also lab work for the male and female. So you're looking at least a full thyroid panel. We're not talking just TSH, because usually general will just do TSH, not do free T3, free T4, TPO, thyroid antibodies. And if you have thyroid antibodies, that's important to know that you can lower them down, even if the medical Western world doesn't think you can. It actually does matter to lower your risk of miscarriage as well. And also, if you do get pregnant, postpartum hemorrhage and stuff like that, there is like complications if you have Hashimoto's that you have to manage. So thyroid panel for both partners, vitamin D3, B12, general CBC with differential. Iron panel, ferritin is a big one I'm seeing with women, is that they have this huge range. And so I think it's like 15 to 100. I might be wrong because I know they're starting to reassess that because people are complaining about it, is that if you're in range, they're saying, oh, you're good to go. But yet they're having iron deficiency symptoms because ferritin is your iron storage in your liver. And so you need to be over 50, not under that. And so there's like certain things I have seen that even like general doctors will just do a CBC, CMP, which is like your liver, kidney function. They'll check all those, maybe TSH. You want to go beyond that. And that's why I call it functional integrative approach. You want to do more in depth and you want to get it done all at once. When it comes to hormonal testing for women, the day in your cycle, if you have regular cycle, is the most important. You want to get your FSH, LH, AMH, estradiol, which is your E2, by day 3 or 4 of your cycle, because then you can get true ratios of where it's at. Your progesterone is standard tested at day 21. So you want to get that done. Male, you want to get estrogen, testosterone, DHEAS for both as well. So like I create usually in my consultation, like I write that all out. And I
Yeah.
say, if you want lab work, get this done. But usually, generally, like a GP, even OB-GYNs, I have not seen them run those extensively like that. So usually I'll give them recommendations for preconception to do that and analysis. And then we can see what we're dealing with from there and then customize the plan. Yeah.
That's
Hope
great.
that answered that.
Good recommendations. Yes, I think that's
Yep.
awesome to be like, okay, here's what we're looking at and seeing where your numbers fall. And I think you could just generally say if you're in the low end of average on any of them, it may be
Yes.
something that you're wanting to optimize a little bit more to increase your chances of conceiving and your health.
And I would also want to say is like people come in, I'm like, I'm taking all the supplements. And I'm like, stop. Don't take 10 supplements at once. You're congesting your liver and it's counterintuitive. And you can't absorb as much as well with that. And so you want to get these testing first to actually see what you need for target supplementation or really good quality, like maybe 2 or 3 of them, and then go from there too.
Yeah, great. Amazing. Let's move into a little bit more of adenomyosis. So for people who aren't familiar, this is a similar thing to endometriosis, but it's inside the uterus rather than outside the uterus, right? So it's some scar tissue that's developed. It is cysts that are developed inside the uterus. So how can Chinese women help people with adenomyosis?
It can help lower the inflammation, lower the pain that it creates a lot of pelvic pressure too. So it helps with kind of like managing the pain, managing the inflammation. There is some specific herbs that can possibly lower like the growth of certain things internally in the uterine cavity, in the endometrial lining. Like usually if it's under 6 millimeters in growth, usually you can shrink it a little bit with Target Chinese herbal formula. I've seen
That's really
that
cool.
with a pre and post. We need more studies on that, but it is more promising where it can kind of, because you're taking this medicine internally and it helps with that environment too.
Yeah. Yeah. So let's talk about where do you feel that your role fits in an endometriosis treatment plan versus like, oh, you're just needing to go to surgery at what, right? Like kind of these,
Yeah.
like I would like physical therapy and acupuncture, we would both fall a little bit more on the conservative, well, completely on the conservative end of treatment, meaning it's not invasive. You're not doing a surgery. We're not cutting things out of you. We're not doing things there. We're doing it without a surgical treatment. But at what point do you feel, is acupuncture's limitations in treatment? And when do you feel maybe somebody needs to go for a surgical consultation?
It's been so interesting because I've been transitioning in my stance on this lately too, because I think one is what the intention and goal of the patient is. What do they truly want? And a lot of them that have endometriosis, they're really well educated. They've done a lot of research. They know how to advocate. And a lot of them are just tired and in pain. And so I think with this medicine and how I stand is very, kind of helps with the whole process. I do a lot of co-care. So whether it's before or after surgery, a lot of times it's like, I think I have endo, but I'm not sure. And I am like this gatekeeper of resources. And it's my job to give them resources, whether it's Western or Eastern. And so I just send them straight to an endometrial incision specialist. I don't recommend them going to OB-GYNs for incision surgery. Go to these specialists
I would
because
agree
I
with that. It's like you're setting yourself up to where it's like there's so much in depth that you need to know about endo that you need to be with a specialist. You do.
yes,
Versus an OB-GYN, they're amazing and I love them. They're
yes,
phenomenal doctors, but they're delivering babies. They're doing other surgeries. They are not experts in endometriosis care. And so I
yes.
agree with you on that. That's like you need to find an endometriosis excisional specialist. Yeah.
Yep. And I send them right to them. If they need,
Yeah.
I'll say, call the office, you need a referral, then we'll see if we can send the referral, or your pelvic floor PT doctor can send the referral in, or we try to minimize the steps as possible because I've already been through a lot. So I just send them right to the source. I actually do encourage if they want to do surgery and they're in a lot of pain, we'll prep them for surgery. If we can't manage it with the acupuncture after like, that 3-month time frame that I'm seeing and herbs are help managing it, then I'm going to say you might need to go to the specialist to see if you need to get that, get surgery again or see if they missed anything or anything has regrown. And then we can help you with post-recovery because I think that is the best tool that they have for right now, depending on the type, especially the invasive type of endometrial lesions that they have right now.
Yeah, that's
Yeah.
great. Tell me a little bit more about your role in healing after surgery. What does that look like?
Oh, so much fun. Usually I wait till you get cleared. So I
Yeah.
don't want to see you for the 6 weeks. I want you to rest. I want you to be at home. Usually if they're cleared from like that 2 week and they're feeling better, I might see them probably about 4 weeks out, 4 to 6 for when they feel comfortable. And most of the time it's for those that are trying to get pregnant. So I will see them and I'm like, no, you have endometriosis. I can see the signs because the guidelines have been updated to screen as symptomology wise too. And
Yeah.
so they get the surgery. We were right. They had endo. So now the goal is to minimize the regrowth and minimize inflammation so that they can reach their goal of getting pregnant. And a lot of times they want to do it naturally or they're working with IVF. So that's where I come into play a lot is that I'm keeping inflammation down. I'm keeping things optimized in the hormonal cascade and, just helping boost the way we can. And if they
Yeah.
have any like scar tissue pain after, I make sure everything's sealed and healed, not red, anything like that. And you can lightly do some acupuncture around the incision sites too to help with that.
Yeah. Tell me then your thoughts on acupuncture and needling and scar tissue.
I love it. It's so easy to treat. So it's kind of one of my favorites because you can see the faster responses to that,
Oh,
whether
yeah.
it's C-section, whether it's a full mommy makeover, tummy tuck. I've seen those too. You can see and feel the scar tissue around. You can see if there's a keloids as well, depending on how it healed, and how, like you said, if you cinch it up and twist it, and it has those wrinkle effects along that too. And so you just do local acupuncture. We call it surround the dragon technique around the scar tissue. And we'll do some other points on the meridians that influences, we call it the sinews, which is like the tissue component of healing
Yeah.
and circulation too. But it releases within, if it's a chronic thing, probably 3 to 4 sessions, maybe 1 to 2 if it's a newer surgery and it's like 3 months post-op kind of thing. So
Yeah.
it's just fun to see the results and they get relief from it too.
Yeah, for sure. It was an interesting discussion I was having with a doc that does endometriosis excision because I was seeing a client for specific scar tissue issues.
Yes.
And the doc said, actually, physical therapists, and maybe we could kind of put acupuncturists in there, have a little different view on scar tissue than I do. And I was like, oh, I'd never thought about that because the doctor's like, scar tissue means things healed well in their book. Do it like things closed up. It means we've got good, strong responses there. Versus I look at it's like, no, we need like blood flow. We need tissue movement. We need abilities of things to slide and glide and move in its own space. Otherwise, it's causing restriction and differences there. So it was just a strategy. I was talking to them a little bit more about like we can help with the scar tissue and how the scarring from the surgery is helping because we as physical therapists will do a technique called visceral mobilization as well, where we're helping the organs kind of move and slide and glide within their space.
Mm-hmm.
And they're like, we actually want to make sure that the organs have
Stay put.
good tissue healing and things. And I'm like, I can see your perspective, but I also see that it's like if we form too much scar tissue, and in these instances of high inflammation, I see that scar tissue forms more readily. And I'm like, we can help improve that so that people aren't having restrictions or like I go to turn and I get a sharp pain and it's like, well, yeah, because things aren't moving well in there.
Exactly.
Yeah.
No, I agree with you completely with what you said. I can see their perspective of because they want sutures to heal properly. Things are closed in, things are in their proper place. And sometimes scar tissue can create a barrier of holding. But definitely, if you see on the surface, on the skin, or I've seen digestion or organ systems be affected by scar tissue adhesions too, that you need to like mobilize and release too.
Yeah, exactly.
Yeah.
One thing I think I guess just a point that I like to make is I think there's we've used poor language to where it's like, oh, we break up scar tissue or things there. And I would say from a physical therapy perspective, it's like, we're not actually breaking up tissue. We're just helping it realign so that it moves a little better.
Yes.
When scar tissue lays down, we know this, it lays down in kind of like this nice, chaotic, web of tissue. And we're trained to say, well, let's just get it in the directions where it needs to resist force instead of resisting every movement that you're going to make.
Yes.
It's like, no, it needs to hold, in your abdomen, right? We need it to hold together up and down, side to side, and a little bit of rotational movements. But if it's resisting every movement that you do, then it can be a problem. And so I think we could both say helping to reorganize scar tissue a little bit into a way that allows it to move and glide and slide easier within the body while still maintaining its strength and tensile capabilities.
Agreed on that. It's same approach on that too. And I use the verbiage of like releasing adhesions because of the stickiness around the scar tissue. So that way you're not, like you said, changing the exact scar tissue, just softening it. So it's the same approach.
Yes, absolutely. Tell me, I'm like, we're going to just shift into a little bit in this kind of post-operative space, or even how does pelvic floor physical therapy and acupuncture work together? Where do you see those, being good adjunct treatments for each other? And kind of what roles do we each play?
I think it's huge. Let's think. They overlap really well, actually, because one, in scope of practice, licensed acupuncturists can't do internal exams. We can do, and I am trained into pelvic floor dry needling, and I can do like the first phase of the layers outside, and I have done those a couple times. But I think what works is we can work on the internal, like I said, the internal systems with the acupuncture of what's causing anything, like, helping with inflammation, helping with recovery, helping with pain or weakness, helping with the nervous system to adapt to a big change after surgery, and your just emotional response too. So we can hit from that angle. And so whether it's local acupuncture, abdominal, lower the legs kind of thing too. But I think with pelvic floor partnering up with it, I like how the mobilization techniques, if they need to do more internal work for like pelvic floor after they're cleared after surgery, the exercises that you have that are specific to the person, not just Kegels, I like to partner up with that because you guys specialize in that. So it kind of complements with each other.
Yeah, I agree. To where you get some really good resets, and then we can help the body learn to use that in a different way. It's like you get a good you get a good release, you get a good improvement in mobility and blood flow, things there. And then it's like, okay, now we're training these muscles how to use that mobility in appropriate ways.
And they can learn how to load it up afterwards too for like what their goals are for lifestyle too. Retraining for their whole new life. Yeah.
Agreed. Let's move in just briefly on how acupuncture can help with painful intercourse for these women that are struggling with endometriosis and they have pain responses that are making intercourse difficult for them.
It depends on why they're having painful intercourse. Like I said, if it's, lesions and growth and restriction and pulling, or also is it a trauma response from just chronic pain cycles too? So I kind of hit it from both angles. And so with permission, I'll do lower abdominal points kind of before the hip bones, below the belly button. And there's certain points in the leg that you hit the liver channel. Like there's different organ systems that actually feed up into the pelvic floor that you can use to help lower pain response without having to do anything internally. And so I'll use that. I'll use microneedling, not microneedling, sorry, microcurrent therapy, which is like a TENS unit clipped onto the acupuncture, which we call electroacupuncture as a definition. And small waves, you're not even seeing muscle jump. You're kind of just, it's smooth and it helps calm the system and has a lot of anti-inflammatory benefits as well. And then I might have them do some breath work in the sides of the ribs because that thoracic area and that coordination of the diaphragm with the pelvic diaphragm is pretty big. So when you're doing the retraining with, acupuncture and, the TENS unit, using breath helps down regulate everything and calm it down as well.
Yeah. So great. For the women listening who spent years with painful periods, and maybe she's finally been diagnosed with endometriosis, or maybe she hasn't, what do you want her to know about managing this disease and getting her quality of life back?
Oh, that's a good one. Well, first, if you found out you just have that endometriosis, you were right all along. You knew exactly what was going on in your body. You are the most intuitive. You know yourself inside and out, even if you couldn't put words to it. And I'm sorry that everything, the whole system let you down up to this point. But there is hope in managing, and there's different systems and different tools. And so sometimes it takes time to see what tools that you can put in your basket to help manage and create a quality of life too. And a lot of it is on you in a sense of like nutrition and lifestyle. Like you have to discern what works for you. and communicating directly and advocating for yourself. I know it's tiring, but it's essential for as a woman to feel empowered with that too. And things are getting better in science, and there will be more options coming that we're seeing in the research too. But there is other systems of medicine that may have answers that you have not found yet, or that will help ease in if you had the surgery with recovery afterwards. There is hope on that too.
Yeah, I agree. I would echo those sentiments 100%. Hope is on the horizon. The medical system is going to finally listen to you, and we're starting to research women's bodies and acknowledge a lot of these diagnoses
finally.
that have not been adequately treated. Yes, and I'm so excited to see the research as it comes out. And I would just end a little bit that it's like endometriosis, it often requires a multimodal approach, and it requires multiple tools. Surgery is really the gold standard of treatment for helping decrease pain, and it really depends what your current symptoms are, if that's your best way to go. And then I'm like looking at other alternative treatments like acupuncture, pelvic floor physical therapy, can be really helpful to have as tools in this toolbox as well, because surgery helps treat a local response, but it doesn't necessarily treat a lot of these centralized pain responses. It doesn't treat the muscle responses. It doesn't address a lot of the inflammatory things that you're dealing with. And so having this multimodal approach, I think, is huge for women who are struggling with chronic pelvic pain. And then we'll even make that broader or a little bit more narrow to those dealing with endometriosis as well. So I would say the goal isn't necessarily choosing one treatment, but it's just really realizing there's options out there for you.
Yes.
And you'll often need multiple providers in your tool basket to be able to help you get back where you want to be. So, well, thanks again for being here with me today. I've learned so much from you, and I love working with you and co-treating with clients together. It's been amazing, and I appreciate your time and educating everyone and hoping to move this idea of endometriosis diagnosis and treatment and finally getting help for what you're experiencing, helping move this forward. I think there's going to be so many women that benefit from this discussion that we had today. And if people want to find you, tell them a little bit how they could get a hold of you, maybe Instagram handle, things there. Where can they find you? Like for you?
Well, I'm located in Logan. The clinic is called Thriving with Eastern Medicine and Acupuncture, and calling is 435-565-6901. Instagram, I'm at Thriving with Acu Utah, so UT. So Thriving with Acu UT. And Facebook is the business name too. That's where they can find me. And
great.
I think, that's it for that.
Okay, well, great. Well, thanks everyone for joining us for this episode of Healing at Your Core. We are excited to empower you and teach you more about the female body, and we hope you'll tune in with us again.
Millions of women are still waiting for someone to take their symptoms seriously. You found this show. Share it. New episodes of Healing at Your Core release every week. Evidence-based, non-surgical, and built around one belief: you do not have to live with this.